In this video, we're going to be looking at some basic stretches for the hip flexors. Now, to really understand these stretches, remember that there are two types of hip flexors. There are the two-joint hip flexors, and there's the one-joint hip flexors. The major two-joint hip flexor is the rectus femoris, one of the quadricep muscles, and it's a two-joint hip flexor because it crosses the hip joint superiorly and the knee joint inferiorly. So if we're going to maximize the stretch of the rectus femoris, we actually need to do something at the hip joint and the knee joint. And in general, to stretch the rectus femoris, we're going to combine hip extension with knee flexion. This is called the modified Thomas stretch. The patient's going to begin in hook lying, as you see right here, but they're then going to shift their body weight diagonally so that they can hang the affected lower extremity, or ipsilateral lower extremity, over the edge of the bed. That's the side we're going to stretch, in this case the right side. I also have a belt wrapped around my ankle, as you see right there, that's going to allow me to pull that knee into more flexion, as you see right there. So initially you can just allow gravity to stretch the hip flexors on that side, but then you can use the belt to pull that knee into more flexion, and you should feel the stretch on the top of the hip right here. Now remember that to effectively stretch the rectus femoris, we need two things: hip extension and knee flexion. We already have knee flexion by virtue of gravity, but again, we can get more knee flexion by pulling on that strap or belt and bending the knee even more. And the hip extension is provided by just simply dangling the thigh off the edge of the table. If the patient can't get into hip extension, but their hip's at least in neutral, that's also fine. Again, as they do more and more of these stretches, they'll probably be able to get a little bit more hip extension as they go. And you want to hold this stretch for about 30 to 60 seconds. We can also use the prone hip flexor stretch, which of course is in prone on the belly, with a belt or a strap tied around the affected or ipsilateral lower extremity, in this case the right side. And again, you're using your arms as shown to pull your knee into more flexion. You should feel the stretch in the same place as you did the modified Thomas stretch. So on the front of the thigh, the part of the thigh that's in contact with the table, as you see right there. Now in this position, you're not really going to get any more hip extension. Okay? That's because further hip extension is blocked. So here it's sufficient just to have the hips in neutral. However, what you want to do is bring that knee into as much flexion as possible, or as tolerated, enough to where you feel a stretch on the front of the thigh. Now in the prone hip flexor stretch, just getting the hips to neutral is sufficient. You're not really going to get any more hip extension beyond this because further hip extension is blocked by virtue of the position on the table. So the way that you stretch the rectus femoris even more is by pulling that knee into more flexion. And again, you're going to hold this stretch for anywhere between 30 to 60 seconds, and you should feel that stretch on the ipsilateral thigh, on the front of the thigh that's in contact with the table. And as you start to tolerate that degree of stretch and habituate to it more and more, you can pull the knee into more and more flexion, as you see right there. Again, discomfort is good, but pain is not. We just want discomfort with this stretch. Now the other two major hip flexors are the psoas major and the iliacus, which collectively comprise the iliopsoas. The iliopsoas muscle group is a one-joint hip flexor, meaning the iliopsoas only crosses the hip joint. It does not cross the knee joint. So stretching the iliopsoas only requires hip extension. The knee position is irrelevant. It can be extended, it can be flexed, it makes no difference. We're now going to look at the active iliopsoas stretch with a step stance on a chair. So my unaffected or contralateral lower extremity, which is the right side, is clearly on the chair. We are not stretching that side. However, my ipsilateral or affected lower extremity, which is the left side, that's the side we're stretching, the left hip flexors. You can use upper extremity support for balance, one or both sides, or not at all if you don't need it. And you're going to shift your center of gravity forward to lengthen the ipsilateral thigh and hip region. If you've got tight iliopsoas, you should feel the stretch in the left anterior hip right here, where the iliopsoas cross the hip joint. Now once you feel a strong stretch in that hip, you can also isometrically contract your gluteus maximus and hold for the duration of the stretch. We are currently doing a hip flexor stretch. The gluteus maximus is the major hip extensor, meaning the gluteus maximus is the antagonist to the iliopsoas. Remember that contraction of a stretched muscle's antagonist further relaxes that stretched muscle via reciprocal inhibition. So if we're in a position where we're stretching the iliopsoas, which we are right here, and we also contract the gluteus maximus at the same time, then the iliopsoas will even further relax, furthering the stretch, and that's via that reciprocal inhibition. So once you're in this position where you feel that hip flexor stretch, just isometrically contract the glutes and you will increase that stretch even further loosening that muscle. And in general, you want to hold this anywhere between 30 and 60 seconds. You can always come out of the stretch when you're done like that, and then sink back in. Get those hip flexors to stretch, and then contract the glutes at the same time to further relax them via reciprocal inhibition. The active iliopsoas stretch that we just looked at is a unilateral stretch, meaning that it only stretches one set of hip flexors at a time. If you want to stretch both sides, then you have to switch which foot is on the chair and which one's on the ground. This iliopsoas stretch is a bilateral stretch, meaning it gets both of them at the same time, although it's not as strong or intense as the active iliopsoas stretch. But this one targets iliopsoas via prone press-up progressions. The starting position here is obviously prone, and you're going to move through the following progression until you feel a strong stretch on the hip flexors. Remember, this is going to be bilateral and on the anterior hip regions where the iliopsoas cross the hip joint. So from prone, assuming you don't feel a stretch there, you're going to come onto your elbows or prone on forearms. Sometimes this is even called the Sphinx position for obvious reasons. If you feel the stretch there, then you'll just hold that. If you don't feel a stretch in that position, you'll come up to a more intense position, prone on hands. Notice my elbows are not fully extended, but I can extend them further to increase that lumbar extension range of motion. And right there, I'm at the top. If I don't feel a stretch in the hip flexors there, it likely means that the hip flexors are not tight. If they are tight, you would feel the stretch there somewhere in that range of motion. So let's suppose I come into this position right here in the prone press-up, right there, and that's where I feel the stretch to my iliopsoas. Now I could certainly hang out right there and get that stretch, but I could also use the principle of reciprocal inhibition that we just talked about, and I can isometrically contract my gluteus maximus and get a further active relaxation or active stretch to the iliopsoas. Again, if I'm going to do that, I'm going to hold that gluteus maximus contraction for the duration of the stretch. And overall, the stretch is going to be held anywhere between 30 and 60 seconds. Once the stretch is done, I can simply lower myself back to the table. Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff.